Graves' disease is known to be associated with increased risk of atrial fibrillation and heart failure with reduced ejection fraction. Both of these conditions are associated with increased mortality and morbidity. The artificial intelligence-enabled electrocardiogram can identify patients at high risk of these conditions, facilitating prompt diagnosis and treatment. Hello, I'm Juan Nasser. I'm a second-year resident in the clinician investigator track at Mayo Clinic, Rochester, in internal medicine and cardiovascular medicine. I'm very happy to share with you some of our findings from our paper entitled Artificial Intelligence Application in Graves' Disease, Atrial Fibrillation, Heart Failure, and Menstrual Changes, which is published in Mayo Clinic Proceedings. This work was the result of collaboration between the cardiovascular department and the endocrine department at Mayo Clinic. In this work, we studied patients who were diagnosed with hyperthyroidism related to Graves' disease at Mayo Clinic between 2009 and 2019, who also had an ECG 2 months before Graves' disease diagnosis or at any time before achieving euthyroidism. We know from previous studies that artificial intelligence-enabled ECGs using a convolutional neural network can identify the signature of silent atrial fibrillation in ECGs obtained while patients are in sinus rhythm with an area under curve of 0.87. The AI ECG is also able to identify the signature of low ejection fraction with area under curve of 0.93, as well as the signature of female sex with area under curve of 0.97. These models give a probability number between 0 and 1 for a given predicted parameter, and this is what we used in our study. 43 of 430 patients developed incident atrial fibrillation. These patients were older, more frequently had hypertension, hyperlipidemia, previous coronary artery disease, chronic kidney disease, and also had a higher probability of silent atrial fibrillation as determined by the AI ECG. Independent risk factors associated with atrial fibrillation included AI ECG probability of atrial fibrillation, older age, and overt hyperthyroidism, which is defined as high free T4 level. The C statistic for the AI ECG probability of atrial fibrillation alone was 0.79. For the multivariate model, the C statistic was 0.85. If we were to include conventional risk factors alone for the multivariate model, the C statistic would have been only 0.79, which was significantly lower than if we include the AI ECG. 12 of 495 patients developed incident heart failure with reduced ejection fraction. These patients had more chronic kidney disease and atrial fibrillation, had higher free T4 level, higher thyrotropin receptor antibody levels, and higher probability of low ejection fraction on the AI ECG. Independent risk factors associated with incident heart failure with reduced ejection fraction included the AI ECG probability of low ejection fraction and atrial fibrillation. The C statistic for the AI ECG probability of low ejection fraction alone was 0.85. For the multivariate model, the C statistic was 0.89. If we were to include conventional risk factors alone for the multivariate model, the C statistic would have been only 0.66. The other thing hyperthyroidism is known to cause is menstrual changes, and it has been long linked to infertility in women. In our study, we found that the AI ECG probability of being a female decreased in women upon the diagnosis of Graves' disease. We observed this probability to increase again after attaining euthyroidism, indicating the sex hormone changes associated with hyperthyroidism. In a subgroup analysis including 72 females younger than 45 years who developed Graves' disease, we found the AI ECG probability of female sex to be significantly lower in those who developed menstrual changes as part of their hyperthyroidism presentation. Our findings have important implications on the clinical practice, as the use of the AI ECG can facilitate identification of high-risk patients with Graves' disease to be followed closely for the development of atrial fibrillation and heart failure with reduced ejection fraction. Moreover, the AI ECG-derived female probability was associated with menstrual changes in Graves' disease. However, future studies to confirm the role of this inexpensive tool in screening for infertility in women with Graves' disease are needed. Thank you all for listening, and I hope you enjoy reading our paper.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.